You see it spreading across the state, this way it's spread across the nation, and that will continue, my guess is, every day. We have right now on hospitalizations, 13% are being hospitalized. None of these numbers are good, but relatively that is a good number. Remember, it's the rate of hospitalizations and the rate of people needing ICU beds. 13% is down. It has gone as high as 20%, 21%, hovered around 18%, 17%, 13% is a good number. Of that number, 24% require the ICU beds. The ICU beds are very important because those are the ventilators. Most impacted states, you can see that New York far and away has the bulk of the problem, and that's relevant for the federal government. That's relevant for the congressional delegation that is arguing for federal funds. Fund the need. Fund the need. New York, we have 20,000 cases. New Jersey, 1,900. California, 1,800. So proportionately, in absolute terms, New York has by far the greatest need in the nation. Again, to keep this all in perspective, Johns Hopkins has studied every case from the beginning, 349,000 cases. Death toll worldwide is 15,000, right? Many will get infected, but few will actually pass away from this disease. Also, this is all evolving, and this is all evolutionary, and we are still figuring it out. There has to be a balance or parallel tracks that we're going down. We're talking about public health, we're talking about isolation, we're talking about protecting lives. There also has to be a parallel track that talks about economic viability. I take total responsibility for shutting off the economy in terms of essential workers. But we also have to start to plan the pivot back to economic functionality, right? You can't stop the economy forever. So we have to start to think about, does everyone stay out of work? Should young people go back to work sooner? Can we test for those who had the virus, resolved, and are now immune? And can they start to go back to work? There's a theory of risk stratification that Dr. Katz, who's at Yale University, is working on, which is actually very interesting to me, but which says isolate people, but really isolate the vulnerable people. Don't isolate everyone, because most people are not vulnerable to it. And if you isolate all people, you may be actually exposing the more vulnerable people by bringing in a person who is healthier and stronger and who may have been exposed to the virus, right? Can you get to a point where the healthy, the people who are most likely not going to be affected, can go to work? Remember, you study the numbers across the countries that have been infected. The survival rate for those who have been infected is like 98%, right? A lot of people get it. Very few people die from it. So how do we start to calculate that in? We implemented New York Pause, which stopped all the essential workers, et cetera. We have to start to think about New York Forward. And Steve Cohen and Bill Mulrow, who I've worked with for 30 years and now in the private sector, they're going to start to think about this. How do you restart or transition to a restart of the economy? And how do you dovetail that with a public health strategy? As you're identifying people who have had the virus and have resolved, can they start to go back to work? Can younger people start to go back to work because they're much more tolerant to the effect of the virus? So how do you turned off the engine quickly? How do you now start or begin to restart or plan the restart of that economic engine? Separate task, but something that we have to focus on.